Hi everyone, Mia J here, your public health consultant as well as your exercise physiologist. Today we are talking all things equity and health, specifically for the HSC. And specifically how health determinants influence the health of all, especially minority groups or populations such as the elderly, disabled, and here we go, especially people experiencing low socioeconomic status or homelessness. One of the biggest concepts in the HSC, PDHPE, is understanding that health is simply not determined just by individual choice. There was a really cool video on Instagram that showed, hey everyone, thank you for joining, that showed it really depends on where you're born and to what family. For example, a mother, brother, sister. It makes a really big difference where you're born, to whom you're born, and just because it makes such a big difference if you are born in a war zone compared to the free and place like Australia, which we have liberty and we don't live in communism. We have quite a democratic population, and it makes a big difference. Hi Aaron, thank you so much. It means the world to me that you're liking my video. I am going to go through this and I'm so excited that you're here. All right guys, let's get started. My name is Mia. I'm your public health consultant and exercise physiologist. Today we're looking at PDHPE for year 12. Yes, we are. Okay, guys. So, really important. I've done a lot of consultancy in the public health and media, physical activity arena. Equity and health, especially the course studied in PDHPE for the HSC or sports science in university or public health, is really important. Health is determined by different influences, and those that are in population groups of minorities or low socioeconomic status have obviously risks of being less healthy. Health isn't simply determined by individual choices. Whether you're born in a war zone or in Australia or a remote area, it will make a difference and an impact on your health, especially the social economic status and educational status of your family. Health is shaped by a range of determinants, including individual, socio-cultural, socio-economic, and environmental. So to do that again, individual, so me, socio-cultural, everybody else, and you can do these hand actions to memorize it. Socio-economic, so show me the money, and environmental factors, so everything around. So again, individual, me, socio-cultural, the community, socio-economic, show me the money, and for the environment around you. Okay, again, me, socio-cultural, the money, socioeconomic, and for the environment, spirit fingers. So let's break these down. We have individual determinants. And in Indigenous and Torres Strait Islanders and people of remote areas, there is a higher rate of preventable risk factors, including smoking, poor diet, that's 2, 3, obesity, 4, physical inactivity, so not walking around. 5 is high blood pressure, so we check usually with the brachial artery. 6 is unsafe alcohol consumption and substance abuse. May you guys never experience those. The risk factors contribute to chronic diseases such as cardiovascular disease, diabetes, and some cancers. There's also an increased rate of disability, visual impairment, and hearing problems resulting from long-term illness. Okay, so those are the individual ones. Individual is really about how you live, physical activity, what you eat, If you're obese, do you smoke? Do you have high blood pressure, unsafe substance abuse, or alcohol consumption? So that's individual. That's one person. That's me. Remember, the next one was socio-cultural. So that is number 2. So that's basically things like loss of land, loss of culture, loss of identity, loss of belonging, loss of language. Historical effects continue to affect health today through intergenerational trauma. So for the Indigenous, the stolen generation. That is quite a traumatic thing to have a baby stolen from you. That's massive, and that is intergenerational. Cultural differences and distrust of Western health systems may reduce engagement with education and healthcare. So that's a really big thing. This is a socio-cultural. So where you are with your culture, language, identity, but also do you experience trauma, intergenerational trauma? Do you experience things like reduced engagement, learning? Do you go to school? Have you been to tertiary education? Do you have access to health professionals such as myself, like an exercise physiologist, a health consultant, or a GP, a dentist? Do you have that access? That is all on the social cultural determinants. And unfortunately, incarceration, so being in prison, is pretty high. And that can happen in remote areas, Indigenous areas, and it is socio-cultural. The third one, if you remember, show me the money, that is socio-economic determinants. So lower education limits employment opportunities. Now, this is not always, but it's proven through research. If you have gone to university, your options of having work opportunities are higher. It makes sense. And many people experience lower household incomes and higher long-term unemployment. So this is a really big thing. Employment is often concentrated in physical demanding labor occupations. So imagine if you're disabled or you can't do that anymore. It's a big problem. And it increases the workplace injuries. That's why you need someone like an exercise physiologist to come and do corporate health assessments and help to engage and motivate and empower the individual and the socio-cultural motivation and enthusiasm to prevent injuries, absenteeism, and improve health outcomes. So the fourth one was our spirit fingers, and that's the environmental determinants. So conditions can significantly affect health. If you live with 1 million cats, or the house is not clean, or there's black mold, or there's overcrowding or poor sanitation, the cats have weed everywhere, or even worse, humans, and you have limited accessibility to safe, clean water, there's going to be a problem, especially if you don't have access to healthy foods and vegetables and fruits. Another problem. And if you live in rural, remote areas and you're not doing anything for agriculture to do your own green leafy vegetables or consume them, again, it's going to be an issue. Especially living in that environmental factor. So remembering where you live makes a big difference. If you're in a remote area and you don't have access to a doctor or a vet or a dentist, it's going to impact your mental health, your entire health. So it's really important. Environmental determinants are really important. So living conditions, again. So remember, individual, social, cultural, money, socioeconomic, access to education, and fourth, environmental factors such as where you live, poor sanitation, or if you have really good sanitation, then you'll have a healthier lifestyle. Now, the most important for me is what I'm doing now, is the role of media. It is powerful to engage, empower, and help. 5+, doing 5 minutes of exercise every day, being physically active, is massive. It's important. It's imperative for your health, for your mental health, for your body, for your physiological health, for your cardiovascular fitness. That's your lungs and your breathing and your heart. It's really important. And the role of the media has a very important responsibility. Rather than focusing on only poor health outcomes, it should also acknowledge positive achievements. So What has your community done that's positive? Is it a sporting star that's promoting health? Like in Fiji, I had the Drua team support this because unfortunately the mortality rates, so the death rates, are very high due to type 2 diabetes, cardiovascular diseases, and the sort. So celebrating sporting success is really important, especially if those role models are doing what I'm doing, using social media to promote health, to promote education. And it really is educational achievement. It is success, it's cultural strengths, it's leaderships, it's challenging stereotypes. So yeah, I may have been brought up in Housing Commission, so Department of Housing, not had a very high socioeconomic status. But who have I been brought around? Did I go to a private school? Did I get great education? Were my parents really strict on me? Did they give me music and do the best that they could with health and sport? Yes, then I've got a higher chance, even though the culture was less than average in terms of economic benefits. So everyone is different, and it really challenges stereotypes, and it builds pride and provides positive role models. So guys, thank you so much for joining that part. Remember, it is individual, it is socio-cultural, it is socio-economic, and it is socio-environmental. Okay, government interventions are really important. They can make legislations and policies. That's why I love working in Fiji and the islands, because they make things happen faster, usually. But remember, we're just people, and we can do this. We can make a big difference. Now, let's look at homelessness. Okay, so if we look at homelessness, really important. If you don't have a place that's safe to live, for example, if there's domestic violence, financial hardships, unemployment, or housing shortages, it does a lot for your detrimental health. Your mental health is so important. There's higher rates of substance abuse, communicable diseases, mental illness, and mortality, sadly, and life expectancy is lower. Individual determinants, so again, on us. Drug use are often consequences of homelessness. It is so sad that there is homelessness. It really is. Imagine if the billionaires in the world made it more accessible for people to have beautiful places to live. You may fall in the rabbit hole of injustice, but maybe this will inspire you to make a difference, because it's really important. Homelessness can often decrease self-esteem, increase feelings of helplessness, feeling like there's nothing you can do, and poor mental health. Social cultural determinants. So homeless individuals experiencing high rates of physical and sexual assault it's absolutely heartbreaking, especially family breakdown and domestic violence. Okay, guys, I have to